Hey, Alpha Nurses and Licensure from alphanursguide.com. This is 20 practice questions. Without delay, let's get started.
A client has undergone a laparoscopic cholecystectomy. Which of the following instructions should the nurse include in the discharge teaching? 1. Empty the bile bag daily. 2. Breathe deeply into a paper bag when nauseated. 3. Keep adhesive dressings in place for 6 weeks. 4. Report bile-colored drainage from any incision. The correct answer is 4. Report bile-colored drainage from any incision. There should be no bile-colored drainage coming from any of the incisions post-operatively. A laparoscopic cholecystectomy does not involve a bile bag. Breathing deeply into a paper bag will prevent a person from passing out due to hyperventilation. It does not alleviate nausea. If the adhesive dressings have not already fallen off, they are removed by the surgeon in 7 to 10 days, not 6 weeks. A 40-year-old client is admitted to the hospital with a diagnosis of acute cholecystitis. The nurse should contact the physician to question which of the following prescriptions? 1. IV fluid therapy of normal saline solution to be infused at 100 ml per hour until further prescriptions. 2. Administer morphine sulfate 10 mg IM every 4 hours as needed for severe abdominal pain. 3. Nothing by mouth until further prescriptions. 4. Insert a nasogastric tube and connect to low intermittent suction. The correct answer is 2. Administer morphine sulfate 10 mg IM every 4 hours as needed for severe abdominal pain. A nurse should question the prescription for morphine sulfate because it is believed to cause biliary spasm. Thus, the preferred opioid analgesic to treat cholecystitis is meperidine. Elderly clients should not be given meperidine because of the risk of acute confusion and seizures in this population. An alternative pain medication will be necessary. IV fluid therapy is used to maintain fluid and electrolyte balance that may result from NPO status and gastric suctioning. NPO status and gastric decompression prevent further gallbladder stimulation. A client is admitted to the hospital with a diagnosis of cholecystitis from cholelithiasis. The client has severe abdominal pain and nausea and has vomited several times. Based on these data, which nursing action would have the highest priority for intervention at this time? 1. Manage anxiety. 2. Restore fluid loss. 3. Manage the pain. 4. Replace nutritional loss. The correct answer is 3. Manage the pain. The priority for nursing care at this time is to decrease the client's severe abdominal pain. The pain, which is frequently accompanied by nausea and vomiting, is caused by biliary spasm. Opioid analgesics are given to relieve the severe pain and spasm of cholecystitis. Relief of pain may decrease nausea and vomiting and thereby decrease the client's likelihood of developing further complications, such as severe fluid loss and inadequate nutrition. There are no data to suggest that the client is anxious. A client's stools are light gray in color. The nurse should assess the client further for which of the following? Select all that apply. 1. Intolerance to fatty foods. 2. Fever. 3. Jaundice. 4. Respiratory distress. 5. Pain at McBurney's point. 6. Peptic ulcer disease. The correct answers: 1. Intolerance to fatty foods. 2. Fever. And 3. Jaundice. Bile is created in the liver, stored in the gallbladder, and released into the duodenum, giving stool its brown color. A bile duct obstruction can cause pale-colored stools. Other symptoms associated with cholelithiasis are right upper quadrant tenderness, fever from inflammation or infection, jaundice from elevated serum bilirubin levels, and nausea or right upper quadrant pain after a fatty meal. Pain at McBurney's point lies between the umbilicus and right iliac crest and is associated with appendicitis. A bleeding ulcer produces black, tarry stools. Respiratory distress is not a symptom of cholelithiasis. A client who has been scheduled to have a choledocholicotomy expresses anxiety about having surgery. Which nursing intervention would be the most appropriate to achieve the outcome of anxiety reduction? 1. Providing the client with information about what to expect post-operatively. 2. Telling the client it is normal to be afraid. 3. Reassuring the client by saying that surgery is a common procedure. 4. Stressing the importance of following the physician's instructions after surgery. The correct answer is 1. Providing the client with information about what to expect post-operatively. Providing information can help to answer the client's questions and decrease anxiety. Fear of the unknown can increase anxiety. Telling the client not to be afraid, that the procedure is common, or to follow her physician's prescriptions will not necessarily decrease anxiety. A client has an open cholecystectomy with bile duct exploration. Following surgery, the client has a T-tube. To evaluate the effectiveness of the T-tube, the nurse should 1. Irrigate the tube with 20 ml of normal saline every 4 hours. 2. Unclamp the T-tube and empty the contents every day. 3. Assess the color and amount of drainage every shift. 4. Monitor the multiple incision sites for bile drainage. The correct answer is 3. Assess the color and amount of drainage every shift. A T-tube is inserted in the common bile duct to maintain patency until edema from the duct exploration subsides. The bile color should be gold to dark green, and the amount of drainage should be closely monitored to ensure tube patency. Irrigation is not routinely done unless prescribed using a smaller volume of fluid. The T-tube is not clamped in the early post-op period to allow for continuous drainage. An open cholecystectomy has one right subcostal incision, whereas a laparoscopic cholecystectomy has multiple small incisions. At 8 a.m., the nurse reviews the amount of T-tube drainage for a client who underwent an open cholecystectomy yesterday. After reviewing the output record, the nurse should 1. Report the 24-hour drainage amount at 12 noon. 2. Clamp the T-tube. 3. Evaluate the tube for patency. 4. Irrigate the T-tube. The correct answer is 3. Evaluate the tube for patency. The T-tube should drain approximately 300 to 500 ml in the first 24 hours, and after 3 to 4 days, the amount should decrease to less than 200 ml in 24 hours. With the sudden decrease in drainage at 8 a.m., the nurse should immediately assess the tube for obstruction of flow that can be caused by kinks in the tube or the client lying on the tube. Drainage color must also be assessed for signs of bleeding. The tube should not be irrigated or clamped without a prescription. The nurse measures the amount of bile drainage from a T-tube and records it by which one of the following methods? 1. Adding it to the client's urine output. 2. Charting it separately on the output record. 3. Adding it to the amount of wound drainage. 4. Subtracting it from the total intake for each day. The correct answer is 2. Charting it separately on the output record. T-tube bile drainage is recorded separately on the output record. Adding the T-tube drainage to the urine output or wound drainage makes it difficult to accurately determine the amounts of bile, urine, or drainage. The client's total intake will be incorrect if drainage is subtracted from it. The nurse is caring for a client who had an open cholecystectomy 24 hours ago. The client's vital signs have been stable over the last 24 hours, with most recent temperature 37 degrees Celsius, blood pressure 118/76, respiratory rate 16 breaths per minute, and heart rate 78 beats per minute, but are now changing. Which of the following indicate that the nurse should contact the physician? 1. Temperature 38.8 degrees Celsius, blood pressure 140/86, heart rate 94 beats per minute, respiratory rate 24 breaths per minute. 2. Temperature 38.2 degrees Celsius, blood pressure 118/68, heart rate 84 beats per minute, respiratory rate 20 breaths per minute. 3. Temperature 37.5 degrees Celsius, blood pressure 126/80, heart rate 58 beats per minute, respiratory rate 16 breaths per minute. 4. Temperature 36.4 degrees Celsius, blood pressure 98/64, heart rate 98 beats per minute, respiratory rate 18 breaths per minute. The correct answer is 1. Temperature 38.8 degrees Celsius, blood pressure 140/86, heart rate 94 beats per minute, respiratory rate 24 breaths per minute. This client is exhibiting 3 of 4 signs of systemic inflammatory response syndrome: temperature greater than 38 degrees Celsius or less than 36 degrees Celsius, heart rate greater than 90 beats per minute, respiratory rate greater than 20 breaths per minute. The fourth indicator is an abnormal white blood cell count, greater than 12,000, less than 4,000, or greater than 10% bands. At least 2 of these variables are required to define systemic inflammatory response syndrome. After a cholecystectomy, the client is to follow a low-fat diet. Which of the following foods would be most appropriate to include in a low-fat diet? 1. Cheese omelet. 2. Peanut butter. 3. Ham salad sandwich. 4. Roast beef. The correct answer is 4. Roast beef. Lean meats, such as beef, lamb, veal, and well-trimmed lean ham and pork, are low in fat. Rice, pasta, and vegetables are low in fat when not served with butter, cream, or sauces. Fruits are low in fat. The amount of fat allowed in a client's diet after a cholecystectomy will depend on the client's ability to tolerate fat. Typically, the client does not require a special diet, but is encouraged to avoid excessive fat intake. A cheese omelet and peanut butter have high fat content. Ham salad is high in fat from the fat in salad dressing. A client with cholecystitis continues to have severe right upper quadrant pain. The nurse obtains the following vital signs: temperature 38.4 degrees Celsius, pulse 114, respirations 22, blood pressure 142/90. Using the S-bar technique for communication, the nurse recommends to the primary care provider for the client to receive: 1. Hydromorphone IV. 2. Dultazem PO. 3. Meperidine IM. 4. Promethazine IM. The correct answer is 1. Hydromorphone IV. Hydromorphone should be considered for pain management. It should be administered intravenously for rapid action to address the severe pain the client is experiencing. Intramuscular injections are painful and slower acting. Since meperidine's toxic metabolite can cause seizures, it is no longer the treatment choice for pain. Dultazem, a calcium channel blocker, is not indicated. Elevation of heart rate and blood pressure is likely due to pain and fever. Promethazine is used to treat nausea. The nurse prepares to administer promethazine 35 mg IM as prescribed PRN for a client with cholecystitis who has nausea. The ampule label reads that the medication is available in 25 mg per ml. How many milliliters should the nurse administer? To solve this problem, you set up the formula as 35 mg over X equals to 25 mg over 1 milliliter. You cross-multiply 35 times 1 and X times 25. You get 25X equals to 35. You divide 25 on both sides, and you get X equals to 1.4 milliliters. A client undergoes a laparoscopic cholecystectomy. Which of the following dietary instructions should the nurse give the client immediately after surgery? 1. You cannot eat or drink anything for 24 hours. 2. You may resume your normal diet the day after your surgery. 3. Drink liquids today and eat lightly for a few days. 4. You can progress from a liquid to a bland diet as tolerated. The correct answer is 3. Drink liquids today and eat lightly for a few days. Immediately after surgery, the client will drink liquids. A light diet can be resumed the day after surgery. There is no need for the client to remain on nothing by mouth status after surgery because peristaltic bowel activity should not be affected. The client will probably not be able to tolerate a full meal comfortably the day after surgery. There is no need for the client to stay on a bland diet after a laparoscopic cholecystectomy. The client should, however, avoid excessive fats. Which of the following discharge instructions would be appropriate for a client who has had a laparoscopic cholecystectomy and has sutures covered by steri-strips? 1. Avoid showering for 1 week after surgery. 2. Return to work within 1 week. 3. Leave steri-strips in place until you see the surgeon at the post-operative visit. 4. Use acetaminophen to control any fever. The correct answer is 3. Leave steri strips in place until you see the surgeon at the post-operative visit. After a laparoscopic cholecystectomy, when there are sutures covered by a dressing or steri strips, the client should not remove dressings from the puncture sites, but should wait until visiting the surgeon. The client may shower 48 hours after surgery. A client can return to work within 1 week, but only if approved by the surgeon and no strenuous activity is involved. The client should report any fever, which could be an indication of a complication. After a client who has had a laparoscopic cholecystectomy receives discharge instructions, which of the following client statements would indicate that the teaching has been successful? Select all that apply. 1. I can resume my normal diet when I want. 2. I need to avoid driving for about 4 weeks. 3. I may experience some pain in my right shoulder. 4. I should spend 2 to 3 days in bed before resuming activity. 5. I can take a shower 2 days later. The correct answers are 1. I can resume my normal diet when I want. 3. I may experience some pain in my right shoulder. And 5. I can take a shower 2 days later. Following a laparoscopic cholecystectomy, the client can resume a normal diet as tolerated. The client may experience right shoulder pain from the gas that was used to inflate the abdomen during surgery. The puncture site should be cleansed daily with mild soap and water. If a Band-Aid was applied after surgery, it can be patted dry or removed and replaced. Driving can usually be resumed in 3 to 4 days following surgery, and there is no need for the client to maintain bed rest in the days following surgery. Light exercise such as walking can be resumed immediately. A client has been admitted to the medical surgical unit following an emergency cholecystectomy. There is a Jackson Pratt drain with a portable suction unit attached. After 4 hours, the drainage unit is full. The nurse should do which of the following? 1. Notify the surgeon. 2. Remove the drain and suction unit. 3. Check the dressing for bleeding. 4. Empty the drainage unit. The correct answer is 4. Empty the drainage unit. Portable suction units should be emptied and drained every shift or when full. It is normal for the unit to fill within the first hours after surgery. The nurse does not need to contact the surgeon. There should not be bleeding on the dressing if the drainage system is emptied when full. The drain should not be removed until prescribed by the physician. The client who has been hospitalized with pancreatitis does not drink alcohol because of her religious convictions. She becomes upset when the physician persists in asking her about alcohol intake. The nurse should explain that the reason for these questions is that 1. There is a strong link between alcohol use and acute pancreatitis. 2. Alcohol intake can interfere with the tests used to diagnose pancreatitis. 3. Alcoholism is a major health problem, and all clients are questioned about alcohol intake. 4. The physician must obtain the pertinent facts, regardless of religious beliefs. The correct answer is 1. There is a strong link between alcohol use and acute pancreatitis. Alcoholism is a major cause of acute pancreatitis in the United States and Canada. Because some clients are reluctant to discuss alcohol use, staff may inquire about it in several ways. Generally, alcohol intake does not interfere with the tests used to diagnose pancreatitis. Recent ingestion of large amounts of alcohol, however, may cause an increased serum amylase level. Large amounts of ethyl and methyl alcohol may produce an elevated urinary amylase concentration. All clients are asked about alcohol and drug use on hospital admission, but this information is especially pertinent for clients with pancreatitis. Physicians do need to seek facts, but this can be done while respecting the client's religious beliefs. Respecting religious beliefs is important in providing holistic client care. The nurse monitors the client with pancreatitis for early signs of shock. Which of the following conditions is primarily responsible for making it difficult to manage shock in pancreatitis? 1. Severity of intestinal hemorrhage. 2. Vasodilating effects of kinin peptides. 3. Tendency toward heart failure. 4. Frequent incidence of acute tubular necrosis. The correct answer is 2. Vasodilating effects of kinin peptides. Life-threatening shock is a potential complication of pancreatitis. Kinin peptides activated by the trap trypsin cause vasodilation and increased capillary permeability. These effects exacerbate shock and are not easily reversed with pharmacologic agents such as vasopressors. Hemorrhage may occur into the pancreas, but not in the intestines. Systemic complications include pulmonary complications, but not heart failure or acute tubular necrosis. A client with acute pancreatitis has a blood pressure of 88/40, heart rate of 128 beats per minute, respirations of 28 breaths per minute, and Gray-Turner's sign. What action should the nurse perform first? 1. Assess the urine output. 2. Place an intravenous line. 3. Position on the left side. 4. Insert a nasogastric tube. The correct answer is 2. Place an intravenous line. Gray-Turner's sign is a bluish discoloration in the flank area caused by retroperitoneal bleeding. The vital signs are showing hemodynamic instability. IV access should be obtained to provide immediate volume replacement. The urine output will provide information on the fluid status. A nasogastric tube is indicated for clients with uncontrolled nausea and vomiting or gastric distension. Repositioning the client may be considered for pain management once the client's vital signs are stable. A client is admitted with acute necrotizing pancreatitis. Lab results have been obtained and a peripheral IV has been inserted. Which of the following prescriptions from a healthcare provider should the nurse question? 1. Infuse a 500 ml normal saline bolus. 2. Calcium gluconate 90 mg in 100 ml normal saline. 3. Total parenteral nutrition at 72 ml per hour. 4. Placement of a Foley catheter. The correct answer is 3. Total parenteral nutrition at 72 ml per hour. Clients with acute necrotizing pancreatitis should remain nothing by mouth with early enteral feeding via the jejunum to maintain bowel integrity and immune function. TPN is considered if enteral feedings are contraindicated. Access is also needed for TPN, preferably via a central line. Hemodynamic instability can result from fluid volume loss and bleeding and requires fluid and electrolyte replacement. Fat necrosis occurring with acute pancreatitis can cause hypocalcemia requiring calcium replacement. A Foley catheter provides accurate output assessment to monitor for prerenal acute renal failure that can occur from hypovolemia.
You can get my NCLEX course review. Links will be in the description. I'll see you guys in the next video.